This is an introduction to federal and state nutrition programs in Idaho, specifically health education among the underserved and SNAP participants. So to start off with, what is SNAP? SNAP is the Supplemental Nutrition Assistance Program. It's a federal program, otherwise known as food stamps. It's used to purchase groceries and other necessities. And there's also an educational portion, which is called SNAP Ed. It's an educational initiative for SNAP participants to teach them about nutrition. Some related programs in Idaho do exist. They're through the Department of Health and Welfare. The first one is HEAL. It's Healthy Eating and Active Living Idaho Network. It is a community collaboration and partnership. There are committees and subcommittees which develop solutions for healthy food to be the easy choice. So basically working on accessibility for those healthy options. It's not directly connected with the federal SNAP program, but the focus is on the disparities. There's also the IPAN program, the Idaho Physical Activity and Nutrition Program. This focuses more on the infrastructure and accessibility improvements such as parks and walkways, those sorts of things for a healthy lifestyle. Again, this is not directly connected with the federal SNAP program, but again, it focuses on the underserved in the community. The last program that exists in Idaho right now is the Eat Smart Idaho program. This is directly for SNAP participants. It's paid for by grants, and it's a collaboration of various agencies such as the USDA, as well as the Idaho Department of Health and Welfare, and a couple other agencies. This provides classes and demonstrations which are taught by nutritional instructors. These classes happen all throughout Idaho for the SNAP participants. Now, these programs all sound nice and they sound like they've got to be successful, right? But there are actually pretty significant barriers to these programs. There was a survey of the instructors of SNAP Ed programs in 2019, and these instructors said that some of these significant barriers were a lack of access to healthy food and physical activity tools. So basically, the participants liked the program, but they didn't have any access to actually have that healthy food to make it. There were also funding restrictions and perceived transportation barriers, so difficulties getting to the meetings or to the classes. There was also a low program recruitment rate, which basically meant there weren't many participants in the program. And lastly, and almost most importantly, the instructors felt like they were outsiders. They weren't really members of the community, so it took a while for them to be warmed up to. So this survey also talked about possible solutions, and one of the main things was to recruit instructors from within the community that was being served. This would really help with program adherence and participation. Another important point would be buy-in from the leaders. An example of this is one of the instructors went directly to the mayor of the community and said, hey, your walkways need to be improved because people are having to walk to the store, and this is a real barrier for them to get healthy food. So the mayor basically jumped right on it and said, you're right, we're going to take care of that. Another thing that can be done is partnering with local companies to improve the recruitment rate of participants. So there was another interesting study about social marketing. A lot of people had the idea that lower income individuals may not have as much access to social media or to the internet, but actually they found in a focus group of SNAP Ed eligible individuals that they did have quite a bit of access to the internet. So the study was basically looking at what marketing tools could be used to improve the education to SNAP Ed eligible individuals in Georgia. This was where this focus group was. And they found that one important key is cooperation between dietitians, health promotion specialists, social workers, and social marketers. There was a test of basically what marketing tools would be more effective, and TV, radio, social media, or being in person. And they found that the most effective seemed to be in person at popular venues that people already go to, such as church, school, library, etc. Another really important point here is to address culture and tradition. For example, in the South, they eat a lot of fried food by tradition and by culture, and it's very difficult to change that tradition and to learn something new and to accustom your taste buds to new and different foods. And another point along with this culture is that the people wanted to see people living healthy lifestyles who were like themselves, who came from the same background, the same culture, the same race. And if those people were portrayed as following a healthy lifestyle, then that would make the participants more apt to do so as well. So another point was that social justice needs to be advocated by social workers and health professionals. In other words, they need to step up and go to the legislature and work for that social justice and equality. So another really important point is collaboration between agencies, between governmental agencies. There was a very interesting study done with the HERO program, the Health Extension Rural Offices program in New Mexico. And what this was a collaboration and pooled resource of the agricultural sector and the health education sector. These are normally two separate sectors or areas of the government, but they both have resources and the shared aim of community service and community health. And what they found in New Mexico was that if those resources were pulled together and if they cooperated, then there was a marked benefit, and they really encouraged more states to build an interagency collaboration. In New Mexico, for example, they did some programs for seniors, for immigrants, for health center patients, and they found that it was very effective. Another difficult ethical topic when we talk about government-funded nutrition programs is a question of prohibition. Now, I'm not talking here about alcohol necessarily. In this case, I'm going to be speaking about sugary beverages such as soda. The question comes up, should government funds be able to be used for sugary beverages which are known to be correlated with obesity? And we know that the obesity crisis is on the rise, especially among low-income individuals. So there is a school of thought out there that the SNAP funds should be banned from being used for sugary beverages such as sodas. Another school of thought is that sugary beverages should be taxed. And the question really is, do governments have that duty to protect health, or do they have the duty to give complete freedom? And one side of this story is that it may actually lead to an injustice against the SNAP participants, where basically they don't have the freedom to buy what everyone else is buying. And again, is this a government responsibility to protect the health of the citizens, or is it social injustice and unfairness? Interestingly, the study by Cass et al. In 2014 made the argument that it was governmental responsibility to protect the health. However, Bamhill in 2011 made an interesting point about possible embarrassment and stigma from being denied this freedom to purchase what they want from SNAP funds. And basically, the example that was used was if someone is buying a soda at the checkout and they're unaware that it's a banned product, they'll be denied at the checkout, and this will be very embarrassing for them. It will bring up a stigma, and they may actually drop out of the program because of the stigma. So Bamhill's argument was that this is actually counterproductive because it might lower the participation rate in the SNAP program. So in conclusion, there are many difficult ethical issues to be examined when it comes to the SNAP program or other governmental programs, and collaboration is really a key. In Idaho, for example, we can look to other rural states and see what they're doing, see what they've learned. Possibly we could even organize structured co-working seminars between agencies and states. And overall, we need to strive to reduce the stigma around SNAP and to solve the disparities. Thank you very much.